So I was actually, I'm going to talk to you about the Quark study, which is actually a treatment trial for non-arteritic anterior ischemic optic neuropathy. So I was going to start with, and I have no disclosures like any good neuro-ophthalmologist, of course, but I will be talking about an experimental drug because that's why we're doing a trial. This is the Cork 207 NAION trial. It's a clinical study sponsored by Cork Pharmaceuticals and Nordic, which is the Neuro-Ophthalmology Research, Disease, and Investigators Consortium. Notice that the R is very necessary in there, actually. It was originally called the Neuro-Ophthalmology Disease Investigators Consortium, but we needed to add an R. So we'll look at I was going to go over the diagnostic criteria for NAION, but I think we're going to just glaze over that just because it's getting late, and I want to make sure everybody, we can all get out here on time, and I also want to make sure I concentrate on the study, which is the most important part. So typically you get a male in their mid-50s who complains of sudden painless vision loss, notices it upon awakening, and feels that the lower half of the vision is missing. This is sort of a textbook case for non-arteritic anterior ischemic optic neuropathy. We can go over the risk factors, but they're very common. Hypertension, diabetes, and hyperlipidemia are very common risk factors. And of course, since these patients tend to be overweight, they may also have obstructive sleep apnea, which is also a common risk factor. So we're going to glaze through this. And of course, this gentleman has a disc at risk in one eye here and an edematous optic nerve in the fellow eye. So, and once you see this visual field pattern, you're thinking this is a slam dunk non-arteritic anterior ischemic optic neuropathy, right? And what we've seen in these patients, which we learned in the ischemic optic neuropathy decompression trial, which by the way was approximately 26 years ago. So we haven't actually had a treatment trial for this disease in over 26 years. And so it's about time that we actually were able to do so. We learned from that trial that these patients will have hypertension, diabetes, hyperlipidemia. We subsequently learned about sleep apnea, and they'll have one or more of these risk factors typically. And so until now, we've concentrated on elucidating these risk factors once we make the diagnosis because we really couldn't do anything about it. And so for years, we've been telling you we can't do anything about it. And it has a relatively high incidence as far as neuro-ophthalmology is concerned, which is 3 per 100,000. It's a little more common in post-cataract surgery, as was shown by a Bascom-Palmer study. But there's really not much we can do for this until now. What the Cork study will do, this is a phase 2-3 randomized, double-masked, sham-controlled injection trial of QPI 1007, which will be delivered in single or multiple dose intravitreal injections and in subjects with acute non-arteritic anterior ischemic optic neuropathy. So QPI 1007 is actually an siRNA. It's a synthetic chemically modified siRNA that will target caspase-2. Now, Dr. Student talked about this earlier, and caspase-2 is a key factor in apoptosis. So what we're basically trying to do here is we're trying to inhibit or stop apoptosis from beginning, basically. So we're trying to begin, and no, neuro is not on call right now, so no. What we're trying to do here is prevent apoptosis, and so that's why the drug has to be given very early on. And so it should be neuroprotective because it has been shown to be neuroprotective in these other models for disease. So the purpose of the study is to determine the effect of QPI 1007 on visual function in these patients. We're going to assess the safety and tolerability as well and evaluate structural changes in the retina using OCT. The effect of QPI 1007 is going to be assessed, or the primary outcome measure will be best corrected visual acuity from day 1 to month 12. And then there'll be safety and tolerability measures using very many tests, as you can see here. The mean change in baseline visual acuity score as measured in ETDRS from day 1 to month 12 will be a secondary outcome measure, and the mean change in visual fields as assessed by Humphrey visual field testing will also, from day 1 to month 12, will also be a secondary outcome measure for this study. So the study is double masked, randomized. So I'll be if I'm the PI, there'll be separate treating investigators, so that the PI can remain blinded or masked to this study. The subjects are going to be randomized into 5 groups: one low dose single injection group, high dose single injection group, multiple dose multiple injections, low doses, multiple injections, high doses, and of course, control, which receives a sham injection. The total study time is going to be 12 months. So there's 20% chance that you may not get treatment, obviously, because there's 5 groups. We are going to be enrolling males and females between the ages of 50 and 80 years of age. They must have a positive diagnosis and first episode of NAION in the study eye. And this is the most important thing. The study eye must be injected within 14 days of onset of symptoms. So if the patient has onset of symptoms 5 days ago, sees someone today and is referred to me on Monday, I have less than a week now to inject this patient. Okay? Because the patient's already been has already had symptoms for 8 days, right? So it's very important that we get these patients in as quickly as possible in order to get them enrolled and injected, because we only have 14 days from onset of symptoms, not from the diagnosis. They have to have clear ocular media and be able to dilate the pupil, and they have to be able to perform an ETDRS visual acuity on day 1. So the take-home message here is that if you suspect you have a patient with NAION, please refer them. Our referral number is 626-817-4747. You tell the person on the other end of the line that you have an NAION patient for the Cork study, and they will actually schedule them within 24 to 48 hours for a visit with us here at Doheny UCLA. If you are having any issues, you can contact me directly at Quiros at jsci.ucla.edu. Because we want to get these patients in as quickly as possible so that we can enroll. Our enrollment goal is actually 10 patients for this clinical site, and I think we can do that in Los Angeles because there's only 2 clinical sites in all of Los Angeles, and the other one is actually in Riverside. It's Loma Linda. So we're actually the only site in Southern California on the sort of west side, so to speak, of the 15 freeway. Right, so we should be able to enroll 10 patients in the next 18 months, but we really need your help in order to do so because obviously the time is very limited in window in which we can enroll these patients. And you do not need to worry about completing the diagnosis. We will do that for you. Thank you very much.